Usually when we talk about a medical procedure, there is an expectation of precision. Like, it feels almost like engineering, you know?
Oh, absolutely.
Yeah, like you break your arm, the x-ray shows that jagged white line, and the doctor just points at the film and says, right there, that's broken.
Right. It's very clear cut.
Exactly. It's clean, it's binary, and honestly, it is incredibly comforting to have things perfectly visible and categorized. But, and this is a big but, you step into the rapidly expanding world of elective aesthetic medicine, and suddenly that x-ray machine is just broken.
Oh, yeah. The clinical landscape, it's very murky, very fast.
Right. Which is why today we are asking a highly specific but honestly incredibly important medical question for you listening, and that is, should an IUD be removed before non-surgical vaginal tightening?
It's funny because it really sounds like a question that should just have a straightforward yes or no answer, right?
You would think so.
You really would.
Yeah.
But looking through the massive stack of sources we have today, and I mean, we're pulling from local cosmetic clinic FAQs, specialized women's health guidelines, all the way to the UK NICE guidelines and a major 2018 FDA safety warning. We see that this specific question about a tiny implanted device touches on a much, much larger debate.
Yeah, a very heated debate.
Exactly. I mean,
Yeah.
we are talking about patient safety, medical liability, and honestly, the intense hype surrounding energy-based medical devices.
Okay, let's unpack this, because
Yeah.
our goal here is to really separate the actual medical anatomy from, well, clinic marketing. But to even begin answering if an IUD needs to come out, I want to take a step back. What even is non-surgical vaginal tightening?
That's the perfect place to start.
Because just to be clear, we aren't talking about surgery. There are no scalpels here, right?
Right. No scalpels, no stitches.
So what is this, like, energy-based wand actually doing inside the body?
So generally, these treatments use one of two types of technology. You've got radiofrequency waves, or you have fractional lasers.
Okay.
A clinician will insert a specialized wand into the vaginal canal. Now, if they're using a radiofrequency device, like the Riva, for example, that wand emits electromagnetic waves. And those waves bulk heat the underlying mucosal tissue to a very specific temperature,
How hot are we talking?
usually right around 42 to 45 degrees Celsius.
Wait, 45 degrees? What happens to human tissue when it hits 45 degrees Celsius? Isn't that
It's hot. Yeah, it reaches a threshold of controlled thermal damage.
controlled damage?
Right, so the body senses that heat as a literal injury. And in response, it triggers this whole cascade of healing. So it rushes blood flow to the area, and it stimulates fibroblasts.
And fibroblasts are...
They're the cells responsible for producing collagen and elastin, basically the building blocks that keep tissue firm.
Okay, so that's the radiofrequency side of things, bulk heating. But what about the lasers? Because I noticed a bunch of our sources mentioned devices like the Mona Lisa Touch, right?
Yes, exactly.
Then that uses, what, CO2 or erbium lasers. How is a laser different from just heating the tissue up?
So fractional lasers are ablative. Think of the process kind of like aerating a lawn.
Oh, like when they punch all those little holes in the dirt?
Exactly. When you aerate a lawn, you punch hundreds of microscopic holes into the soil to allow water and nutrients to get in. And that forces the surrounding grass to grow back thicker and stronger.
Okay. I see where this is going.
Yeah, a fractional CO2 laser does something very similar to the vaginal mucosa. It literally vaporizes tiny microscopic columns of tissue.
Oh, wow. Vaporizes it.
Yep. But it leaves healthy tissue completely intact around each microscopic wound. So the body just rushes to heal those tiny holes, which remodels the tissue, attempting to make it, firmer and more lubricated.
I mean, I understand the mechanism now, but this immediately brings up a pretty terrifying visual for me and probably for you listening right now.
Let me guess, the metal.
Yes. If a patient has a copper T IUD, which literally contains metal, or even a dense plastic hormonal IUD, and we are introducing extreme heat or vaporizing lasers right next to it, I mean, isn't that just like leaving a metal fork in the microwave?
It's a very vivid image.
Like, why doesn't the IUD heat up and just burn the patient from the inside out?
I mean, it is a totally logical fear. You are applying intense thermal energy in the exact same neighborhood as a foreign object.
Right.
But the defense from a lot of these cosmetic clinics comes down to the physics of human anatomy. There's a clinic called Avant Gynecology, and they use this really great analogy in their FAQ.
The bank vault one.
Yes. They describe the cervix as acting like a bank vault door.
Okay, I like the visual of a bank vault, but how does that actually play out in terms of the physics? Why can't the laser just penetrate the vault?
Well, it has to do with tissue density and the specific wavelength of the energy being used. So the cervix is this thick, dense ring of fibromuscular tissue. It forms a solid barrier between the vaginal canal and the uterus.
Okay.
And your IUD, whether it's a plastic marina or, a metal-containing Paragard, it is locked safely away inside the uterine cavity, high above that cervical barrier.
So the energy from the wand just isn't, powerful enough to get through the door.
Exactly. It is physically not designed to go through the door. Fractional lasers and the radio frequency waves used in these specific aesthetic devices, they are calibrated to only penetrate a few millimeters.
Just the surface layers.
Right, just into the superficial mucosal walls of the vagina. The kinetic and thermal energy completely dissipates within those top layers.
Oh, I see.
It literally runs out of power before it can cross the dense, thick tissue of the cervix. So because the energy cannot physically reach the uterus, it cannot superheat the metal of an IUD, it can't melt the plastic, and it definitely does not alter a woman's chances of becoming pregnant.
Okay, that actually makes perfect anatomical sense. The remodeling is all happening out in the lobby, and the valuables are locked deep inside a vault that the heat just cannot reach.
Precisely.
But if the physics are so absolute, and this is what tripped me up, I don't understand why the Women's Health Clinic, which we'll just call the WHC for now, why do they treat this with such extreme caution?
Ah, yes, the WH.
Because their clinical FAQ explicitly states that having an IUD does not yield a blanket answer for safety. What are they seeing that the standard cosmetic clinics are just ignoring?
Well, they are acknowledging a very real fact, which is that anatomy is not static. The bank vault logic is brilliant, honestly, but it relies entirely on one huge assumption,
Which is?
that the patient's internal structures are sitting exactly where they are supposed to be. The WHC points out a critical physical exception, and that is uterine prolapse.
Right. And what exactly is happening during a prolapse that, changes the math on this whole vault theory?
So the uterus is normally held up by this sort of hammock of pelvic floor muscles and ligaments.
Right, the pelvic floor.
But if those supportive structures weaken, which is super common, often due to childbirth, chronic straining, or just aging, that hammock sags, and the uterus actually begins to drop down into the vaginal canal.
Oh, wow.
Yeah. If a patient has a moderate or severe uterine prolapse, the bank vault has effectively descended.
It just drops right into the line of fire.
Yes. The cervix and the IUD sitting just inside it are suddenly brought directly into the treatment zone of that laser wand.
That safe distance is completely gone.
Completely gone. In cases of moderate to severe prolapse, using these energy-based devices is strictly contraindicated because you just cannot guarantee that the energy won't interact with the device or hit deeper uterine tissue.
That makes a lot of sense. And, the WHC source also included this deeply extensive safety checklist for clinicians to follow before they even, turn the machine on.
So very thorough.
It really is. It wasn't just about checking for prolapse. They require clinicians to physically locate the IUD strings. And they screen for a whole host of underlying conditions.
Which is so important.
Yeah, I wanted to ask about that. Why is it so crucial to screen for something like an active urinary tract infection or bacterial vaginosis before using a laser?
Okay, if we go back to that lawn aeration analogy, it becomes very clear.
Okay, I'm picturing the holes in the dirt.
Right. Fractional lasers are creating hundreds of microscopic open wounds in the mucosal tissue. Now, if a patient has an active infection like bacterial vaginosis or thrush or a UTI, the surface of that tissue is currently covered in harmful pathogens.
Oh, no.
Yep. If you punch microscopic holes into infected tissue, you're effectively driving those surface bacteria deep into the mucosal layers and potentially right into the bloodstream.
So you are basically pushing the infection past the body's surface defenses.
Exactly. And that can trigger a severe systemic pelvic inflammatory response. A cosmetic laser should simply never be used on compromised tissue.
That sounds incredibly dangerous.
It is. The WHC emphasizes heavily that an aesthetic device cannot be used to bypass a proper medical diagnosis.
Right.
This raises an important question, because if a clinician cannot find the IUD strings, or if the patient is experiencing unresolved pelvic pain, just proceeding with a cosmetic laser treatment anyway is incredibly reckless.
Okay, so a prolapse eliminates the safe distance, and an infection makes the microinjuries totally dangerous. That makes a ton of sense. But as I was reading through the rest of our sources, I found a massive, glaring contradiction.
Oh, the clinic policies.
We have places like Graper Harper Cosmetic Surgery in North Carolina stating right on their website that treating a patient with an IUD is, quote, absolutely painless and safe.
They lead entirely on the bank vault theory.
Exactly. But then you look at Eve clinics in the UK, and they use the exact same type of technology, a Mona Lisa Touch CO2 laser, but their website explicitly lists you have coil fitted under their section of who is not a good candidate.
Yep, it is a complete flat-out ban on IUDs.
And it isn't just the cosmetic clinics doing this either. I looked at a listing for a clinical research trial on CenterWatch. This was a really high-level trial studying vaginal radiofrequency for tissue atrophy in breast cancer
A
patients.
very serious medical setting.
Right. And under their strict exclusion criteria, they banned anyone with an IUD. So if the science says the uterus protects the device, why would high-level clinical trials and certain specialized clinics just flat out ban patients who have them?
It's a great question. And honestly, it has very little to do with the physical melting of the IUD.
Really?
Yeah, it has everything to do with liability, regulatory scrutiny, and just a glaring lack of long-term medical data. We really have to look at the massive medical warning that was issued back in July of 2018.
Okay, what happened in 2018?
The FDA released a severe safety communication. They explicitly warned the public that these energy-based devices, both the lasers and the radiofrequency ones, have not been cleared or approved for vaginal rejuvenation.
Wait. If they aren't FDA approved for vaginal rejuvenation, how on earth are they being used in all these clinics?
So they are FDA approved for general surgical and gynecological uses, things like ablating precancerous cervical tissue or destroying warts, but using them to cosmetically remodel vaginal tissue or to treat the symptoms of menopause. That is considered off-label use.
Ah, off-label.
Right. And the FDA stepped in because they started receiving these really alarming reports of serious adverse events from patients who actually underwent these off-label cosmetic procedures.
What kind of adverse events were being reported? Because that sounds serious.
Very serious. Patients were reporting severe vaginal burns, extensive scarring, and chronic debilitating pain during intercourse, which is clinically called dyspareunia.
Wow. How does a device that is supposed to just gently stimulate collagen end up causing debilitating chronic pain? Like, what is actually going wrong on a cellular level there?
It happens when the thermal damage crosses the line from, a controlled injury to uncontrolled destruction.
Like leaving it in the oven too long.
Exactly. If the radiofrequency bulk heats the tissue too deeply, or if the fractional laser settings are just dialed too high, the heat doesn't just stimulate those fibroblasts, it completely denatures the proteins in the tissue.
Oh.
Yeah, it basically coagulates the blood vessels. And the body cannot regenerate healthy collagen under those conditions. So instead, it replaces the necrotic, dead tissue with thick, rigid scar tissue.
And scar tissue isn't flexible.
Not at all. It completely lacks elasticity. And worse, it can physically pull on underlying nerve endings, which is what results in that severe chronic pain.
That is horrifying. And the FDA wasn't the only organization sounding the alarm on this.
No, major medical bodies globally stepped in. The American College of Obstetricians and Gynecologists issued a committee opinion stating that the safety and effectiveness of these procedures are simply not documented.
Right.
And the UK's NICE guidelines state that transvaginal laser therapy should really only be used in the context of a highly controlled research setting, because the evidence of safety is just so incredibly poor.
Which perfectly brings us back to my question about why Eve clinics and those clinical trials ban the IUD.
Exactly. If we connect this to the bigger picture, because of these stark medical warnings and the looming threat of massive liability if a patient suffers a severe burn, conservative clinics want to eliminate any potential confounding variables.
So they basically just want a clean diagnostic slate.
Precisely. Imagine a patient with an IUD comes back to the clinic 2 weeks after a laser treatment, complaining of agonizing pelvic pain.
The clinic wouldn't know what caused it.
Right. The clinician is suddenly trapped in a diagnostic nightmare. Is the pain caused by rigid scar tissue from a laser burn? Or did the IUD coincidentally shift and perforate the uterine wall?
Yeah, that makes total sense.
To avoid trying to untangle those two massive liabilities, conservative clinics simply say no coils allowed. They ignore the anatomical bank vault theory entirely, purely in favor of legal risk management.
That is just wild. It really highlights how fragmented and honestly unregulated this specific corner of the industry is right now. But looking at all of this, like the FDA burns, the prolapse risks, the diagnostic nightmares, it really makes me think we might be focusing entirely on the wrong thing here.
How do you mean?
Here's where it gets really interesting. We are obsessing over the laser and the IUD, right? And we're potentially missing the actual root cause of why a patient walked into the clinic in the first place.
I agree completely. The hyper-focus on the device itself, often masks a severe problem with misdiagnosis. Let's look at why a patient typically seeks out vaginal tightening to begin with.
Usually they're experiencing a physical sensation of looseness or laxity.
Exactly.
But wait, we just established that non-surgical lasers and radiofrequency wands only penetrate a few millimeters. Like they only treat the mucosal skin layer. They absolutely do not reach deep enough to alter or strengthen the pelvic floor muscles.
And that distinction is vital, because a patient's feeling of looseness frequently has absolutely nothing to do with the superficial mucosal layer.
Right. The sources we reviewed are incredibly clear on this. That sensation could easily be the result of deep pelvic floor muscle weakness following the physical trauma of childbirth.
Okay, but what other structural issues cause that sensation? Because surely it isn't just postpartum trauma.
Oh, definitely not. It can be caused by chronic downward pressure on the pelvic floor. So, say a patient suffers from severe chronic constipation. They are repeatedly straining those muscles.
That makes sense.
Or a patient with a chronic cough, perhaps from asthma, or decades of smoking. They're constantly exerting downward force that weakens that pelvic hammock over time.
Now, the WHC materials also mention hypermobility spectrum disorders like Ehlers-Danlos syndrome. How did that factor into all of this?
So Ehlers-Danlos syndrome, or EDS, is a genetic disorder that affects the body's connective tissue. Think of collagen as the mortar holding the bricks of your body together.
Okay, the mortar. In Ehlers-Danlos, that mortar is fundamentally faulty. The tissue is excessively fragile and stretchy. So a patient with EDS might experience vaginal laxity simply because their connective tissue physically cannot hold its shape.
But firing a fractional laser at faulty connective tissue isn't going to fix their genetic code.
Nope.
You can't force the body to produce strong collagen if it literally only knows how to produce flawed collagen. You are essentially trying to fix a crumbling foundation by putting new, highly expensive wallpaper up in the living room.
That is exactly it. It is an incredibly expensive misdirection. And if you have a torn levator antemuscle from a difficult childbirth, a radiofrequency wand heating the surface skin to 45 degrees will do absolutely nothing to repair that torn muscle.
Zero.
Right. Furthermore, we see a lot of patients seeking out these lasers because they are experiencing vaginal dryness, burning, and painful intercourse associated with menopause.
Right.
This is a recognized medical condition called genitourinary syndrome of menopause, or GSM.
Well, if GSM is a formally recognized medical condition, there has to be an established, proven treatment for it that doesn't involve, an off-label aesthetic laser.
There absolutely is. The gold standard, deeply researched, and fully FDA-approved first-line medical treatment for genitourinary symptoms of menopause is local estrogen therapy.
Oh, just estrogen.
Yes. Applying highly localized, low-dose estrogen creams, tablets, or rings directly to the vaginal tissue restores the tissue's thickness, its elasticity, and lubrication safely and effectively.
Okay, so why on earth are patients paying thousands of dollars out of pocket for an off-label laser treatment that the FDA actively warns against when a proven medical hormone therapy just exists?
Because energy-based aesthetic devices are heavily aggressively marketed. I mean, there are billboards, social media influencers, and these pristine med spas pushing these devices as the modern high-tech solution to women's aging.
Right, they make it look glamorous.
They do. Patients are often bypassed straight to the cash pay laser without ever being informed that a standard insurance-covered estrogen cream could actually solve their problem without any of the risk of thermal burns.
Wow. So, bringing all of this back to you, listening right now. If you came here asking, should my IUD be removed before vaginal tightening? The answer is, honestly, incredibly layered.
Very layered.
Yeah, from a pure physics standpoint, the anatomical theory heavily suggests your IUD is perfectly safe. It is locked behind the dense tissue of the cervix, completely unaffected by the shallow energy of the wand.
But the clinical reality is just much messier than the physics.
Right.
The true answer depends entirely on the current state of your anatomy.
Right.
Do you have a uterine prolapse that has shifted the IUD into the treatment zone? Do you have an underlying infection that a laser will just push deeper into your bloodstream? And frankly, it also depends on the specific clinic's legal risk tolerance in the shadow of those severe FDA warnings.
So really, the safety of the IUD is almost secondary. The primary concern you need to have is ensuring you actually need an energy-based device in the first place. You have to advocate for a comprehensive clinical assessment to ensure you aren't being sold a high-tech laser for a structural problem that actually requires pelvic floor physical therapy or a hormonal problem that requires localized estrogen.
It really is a perfect storm of conflicting guidance, aggressive marketing, and defensive medicine. And looking at all these sources together, it leaves us with a rather profound and honestly somewhat troubling realization about the broader landscape of women's health.
Yeah,
We
definitely.
have an entire multi-million-dollar aesthetic industry operating in a massive gray area, to the point where high-end clinics cannot even agree on the basic safety parameters of treating a patient with a standard, globally used birth control implant.
It's
It
crazy.
makes you wonder how this market grew so large so fast without the clinical data to support it. And it points to a very real historical phenomenon, which is the normalization of women's pain.
Yes, exactly.
For decades, when women have complained about postpartum discomfort, pelvic floor weakness, or the agonizing symptoms of menopause, mainstream medicine has frequently just dismissed them, telling them it's just a normal part of having a baby or getting older.
You just have to live with it.
Right. But when standard medical care dismisses your chronic discomfort, you become incredibly vulnerable to aggressive aesthetic marketing. It forces patients into a position where they are willing to participate in a very expensive, highly unregulated exercise in trial and error, simply because a cosmetic clinic was a first place to finally acknowledge their pain and promise them a solution.